if you could only have a new you, and so many people make resolutions at the new year thinking, I want to be the best I can ever be and feel good on the inside and the outside.
Indeed, you want to look your freshest, perhaps your youngest. You want to just give yourself a boost. The New You. It's North America's largest cosmetic enhancement and anti-aging show for the consumer. It's back, and we welcome founder of the 2006 New You show, Ann Kaplan, and plastic surgeon Dr. Ali Adibfar. How are you both?
Very
Great.
Good to have
Why
you
don't
here.
they look young, fresh, and beautiful?
Yes, yes, you do.
They look fantabulous.
Yeah, it's like
I
before
feel
and
about
afters
like
here.
150 years old standing next to you.
Does one have to have a real radical surgery to feel a little better?
Absolutely not.
No.
There's all these types of options, and they're at the New You Show. You can have even just makeup or your nutrition. Those kind of things are available at the New You Show. There's injectable fillers, so like Restylane for plumping and filling. We can talk about that a bit more. And BOTOX for the wrinkles. Everyone's heard of BOTOX.
There's so many things to do. So it's interesting that there's an entire show for people, regular people such as ourselves, so not people in the industry, come in and they just want to learn a little bit more about some small changes that they can do.
And right up to surgery too.
Right on up to the surgery.
Dr. Ali, what questions should we be prepared with coming to the show? What do people come up to you and say and asking you?
Well, I think question-wise, you should just have an open mind about cosmetic procedures in general, and try to find out what levels there are as far as invasiveness of procedures, and basically try to find out how many non-invasive procedures are out there to make somebody look more beautiful and younger as well.
Oprah did a whole show on that. I watched that. That was quite interesting indeed. And we have a number of things in front of us. Can we show these up in the middle here? These would be your traditional breast implants?
Is this one of them still the top surgery that is done?
For men,
implants?
for some reason, yes.
It is one of the most common ones. Liposuction is very common as well.
Okay.
That's true.
That's
Okay.
correct.
So we have two different kinds of silicone
That's
right
right.
here.
Yep,
So
these
which do we have here?
So these are both called cohesive type silicones. So this is more of a gel type.
This is
In
the
other
gel.
words,
This is the gel.
the gel.
More like a toffee type material. This is more a what's called a cohesive 3, and it's more of a gummy bear type.
Okay.
So slightly harder, but if this is cut across, it'll look like a gummy bear. It'll feel like a gummy bear.
Okay.
Oh, it will.
That's correct.
And they're going to be on tables at the New You Show. You can actually go and feel them.
I've never felt
on
them
the table.
before.
I haven't either. Not like this, anyway. No, I can't. Come on. I'm a married spud. I can't.
This is the same in my opinion.
Yes, in fact, what we have here is a mirror can-feel system simulator, which actually is great for the patients. You can take a pre-procedure photograph of them and kind of simulate what they're going to look like once they undergo the procedure.
That's wonderful. So you are giving people a realistic look at what they can achieve, because do you not find that people have kind of the misconceptions about what they'll actually be?
Misconception, and sometimes they're confused what they're going to look like.
Let's see the
Yeah, let's do
This is where
something
this
here.
comes very
Let's
handy.
talk.
So what we're going to do here in this specific patient, you can see areas of aging, such as the tear trough area.
Yeah.
Right.
And the laugh lines or the nasolabial folds. It's slightly more prominent on her left than on the right.
Yes.
As well as some descent of her jowls and the marionette lines that are being depicted over there.
Right.
And some pre-jowl concavities over there.
Okay.
So we can really treat this patient with non-invasive procedures now. For instance, the use of Restylane filling material. By filling volumetrically those areas, you can actually give a lift to this patient's face and make her look youthful. And the beauty of this program is that you can actually simulate it ahead of time and show it to the patient. So let's try to see if we can fill up some of those areas in our simulator. For instance, the tear trough.
Wow, look at that.
As well, the tear trough, as well as some of the laugh lines. And once we go through this, we can show you a before and a simulated after of this patient.
Look at this.
And,
look at the ears dropping off here.
This is amazing.
This is amazing.
Yes.
It's Catherine Zeta-Jones underneath it all, it seems, you know?
Wow. Now
That's the after one.
That's at the Restylane booth at the show. So you can actually go to the Restylane booth.
and this is what we're talking about right here is Restylane.
That's correct.
Now, how long has this been on the market, popular?
In North America, in about 7 years. So about 5 to 7 years, but in Europe, it's been there longer.
Wow.
And most recently in the States, they had it about a year and a half ago in the States. So.
Okay. Now, everybody knows our next friend right here, the BOTOX.
That's correct.
Now, this is used primarily to treat lines.
More specifically, wrinkles caused by hyperactivity of muscles of the face.
What does that mean in layman's terms?
Your laugh line, your
smiling lines,
squint lines, your frown lines.
I got a lot of
sometimes the wrinkles around the lips for smokers. It's great for those. Sometimes the wrinkles in the neck.
Right.
It's really helpful in those areas.
Is there any? What are you doing? You are perfection.
That's true.
Here's my 20. Is it safe? Is it always going to be things like this?
In the dosages that we use it on the muscles of the facial expression, it's very safe. I use this for my own mother, sister, and girlfriend.
You do your own mother, sister, and girlfriend with
this? That's correct.
Okay.
Now, you're giving a talk specifically about BOTOX and body sculpting, right?
That's correct.
Right.
Two separate talks.
Okay. So you can log on to the website, www.newyou.ca, and you can register there for those talks.
That's correct.
Now, question. In the old day, we saw Geraldo Rivera on live TV get a needle in his rear, and they tried to put it into his face, hurt like mad. I got such huge laughs out of that. Nowadays, with things like Restylane, it's very, very simple to look a little younger and youthful. Isn't
That's
that
correct. So with a new synthetic material such as Restylane, you don't need to go and harvest fat in order to inject it back in your face.
How long will this last?
Depends on the area that you place it in. It can last anywhere from 6 months to 12 months.
And what sort of noticeable difference is there, obviously? Do people come up to work and go, have you done your hair? You know when somebody shaves their mustache and you can't tell why they look different?
That's correct. Well, first of all, it depends on how much you're placing in the face.
Sure.
But the common comment after the initial swelling, people say you look very relaxed, rested. What did
you've
you
come home from a vacation.
Exactly. Where did you go?
Well, I want to have a little vacation from my regular self.
Thanks, Ann.
Imagine. We're going to go to the New You show. Thanks very much.
Thanks a lot.
Thank you.
Thank you, guys.
Very kindly.
www.newyou.ca.